Welcome to another edition of Talk City Greensboro, produced by GTN, featuring interviews and events happening around town. It's an easy way to stay in the know while you're on the go. Subscribe to Talk City on iTunes, Pandora, or SoundCloud so you can keep up with what's going on in Greensboro city government and beyond. I'm your host, Rodney Dawson, and I'm glad to be here solo today. Rosemary is out doing Rosemary things. And I want to remind you how the city of Greensboro is always striving to outline or highlight programs and initiatives that better our communities. One way to help this come about is to ensure that we all have proper access to facilities, information, programs, and language can be a barrier in that effort. So today we will discuss how to bring solutions for that problem. There are people and technology out there designed to achieve this goal. Joining us today on Talk City Greensboro is Stanley, the CEO of MyASL Teacher Rocks, as well as the Parent Rock Readiness Project. I might ask you to differentiate those for me. And Summer, thank you for being here today and welcome to Talk City.
Thank you. I'm excited to be here, Rodney.
All right. Before I ask you about you and what got you in this type of work, break that down for me. What's the difference between MyASL Teacher Rocks and the Parents Rock Readiness Project?
So the simple difference is MyASL Teacher Rocks is an LLC. Parents Rock Readiness Project, that's our nonprofit entity, which is fully ran by our executive director.
Okay.
And so I'm the founder and CEO of MyASL Teacher Rocks, the founder of Parents Rock, and I'm also the founder and CEO of Inclusive Scan.
Got a lot of jobs.
You know what? I'm an entrepreneur.
Hey, yes. You got to be, especially today.
Absolutely.
So, I see the colors you have on. I see the bubbly spirit. I can kind of get an idea. But what got you to this type of work where you wanted to serve people in this way? Was it someone or something that influenced you?
So that's a layered question.
All right.
So I'll start first by acknowledging my upbringing. I'm originally from Miami, Florida, and growing up, we moved a lot.
Okay.
So I had the opportunity to engage with various communities and cultures and just navigating different spaces, which made me very aware of people's differences.
Okay.
During that time, obviously, dealing with different communities, I saw disparities take place. And so I remember, even as a young person, wanting to speak up against that. I was the kid in class. If a teacher did something that I felt was not appropriate towards a student, I was the one to say, hey, that's not right, and we have to fix that. And would go home and tell my mom, like, Mom, you got to come down and talk to this teacher. So I definitely, pay homage to how I was raised.
Okay.
As far as individuals who I feel influenced, I would say Shirley Chisholm is actually one of my sheroes, I guess you would say. She was a trailblazer for civil rights. Her famous quote that everybody should know, if they don't give you a seat at the table, you bring your own. That quote I feel I have lived by. And within the last few years, I've kind of made it my own, where my whole personality is, if they don't give me a seat at the table, I'm building my own table.
Right.
And now I'm controlling who sits at this table. I'm not even fighting this. I'm not pulling a chair to your table. If you don't want me there, I'm not going to come. Right? And so that would be the who. And I would be remiss if I didn't mention my spiritual side.
Okay.
I truly believe that my purpose, my assignment is divine. It's by faith that I walk as confidently as I do in the spaces that I have to enter sometime. But I know that, I have to acknowledge God's presence in my life and what I do and what he allows me to do in this space.
Well, we appreciate you.
Absolutely.
And it's not bad to model yourself after Shirley Chisholm.
Absolutely.
Did you see the movie?
I did.
What did you think of it?
I liked it, but I've read so much about her that I always hold on to what I read.
Right.
Yeah. So the movie was fine, for people who prefer that visual, but reading about her the movie doesn't do justice.
Good news. Good news. Okay, let's move forward. Talk to me about MyASL Teacher Rocks.
Right. So MyASL Teacher Rocks was built from reluctance and me having to move in obedience. I was a working interpreter, ASL interpreter in the community.
So you interpret as well?
I was an interpreter. I no longer practice.
Okay.
5 years ago, I noticed there was a gap in representation in our field, and there still is. There's about 11,000 interpreters nationwide, and I want to say less than 10% of those are African American. A lot of that has to do with the fact that there's currently no HBCU that offers American Sign Language as an undergrad or graduate program. So that's probably a lot of it.
Not one.
Not one. We're working to change that. But not one. And so our experiences in the educational setting leaves us with imposter syndrome. It's a lot of systematic barriers that plague us in those spaces. And so when I finished my first degree, I went out into the field and I got a feel for it, but I saw the things that were happening. And I'm going to tell you, as an interpreter, you have to live by a code of professional conduct, just like most professions. So just like most professions, you can't operate in your own, by your own decisions. You have to maintain confidentiality. You have to maintain your role as the professional. As an interpreter and having a spirit like mine, that does not mesh well, because having to just stay and interpret when I hear someone being racist or I hear someone doing something that I don't agree with would just have me on fire. And so in 2020, I decided to just launch my own organization. And when I launched MyASL Teacher Rocks, it was created to provide accessibility solutions, American Sign Language classes, and exposure to inclusion for various communities with a focus on Black and Brown communities. I'm a firm believer that nobody thought they could be president until we saw Obama. Right. So if I want young African-American boys and girls to become interpreters or educators one day, they have to see us in the classroom. They have to see us doing that. And so that's why I launched MyASL Teacher Rocks.
All right. I'm curious. Are the HBCUs that you've approached, if you've approached them, are they receptive or?
They are, but I think there's a lot of red tape. So we've talked to North Carolina A&T. I have a couple of upcoming meetings with Shaw University where I'll be starting in the fall at the School of Divinity. Okay. And so we've started conversations, and I'm hopeful that North Carolina is going to be the first to do it. I'm confident about that.
Well, let's see. We can get that Aggie pride in there.
Absolutely. I would love, listen, have you seen our Blues Make Us Gold?
I've seen it.
Okay.
Yeah. It's on Prime, I believe.
It's on Prime. Well, I went to the in-theater showing. I went into the one in Charlotte.
Okay.
Yeah. Okay. Listen, I already told my kids, that's where y'all going. Right. Period. Y'all going to North Carolina A&T. So, yeah, I don't have the luxury of saying that I've attended, but I've partnered with them on several, several workshops, trainings. So we've done an accessibility training with their pre-med department. We've partnered with the Department of Counseling there for Mental Health Month. So, yeah, I love that.
Speaking of partnerships, I've read a little bit, and I know you have one with Cone Health.
Yes.
Which is going to lead me to my next question. Sure. So we can expound on that in a little bit. But
Absolutely.
So you've talked to us about MyASL Teacher Rocks, and there's a program that you have where you're marrying technology to improve health outcomes for traditionally marginalized community, and it's called InScan?
Yep, Inclusive
Scan accessibility program. Give us some details on that.
So Inclusive Scan is actually my second business. We launched last year and we are transitioning to a C Corp. Inclusive Scan was designed with every community in mind. Everyone takes in information differently. And currently, if someone gave you a pamphlet on your health, it would be given to you in printed information or a website for you to go read heavy jargon and information that may not fully allow you to comprehend. That's the case for 60 million Americans who live with a disability, and we're just talking about the ones who actually have a disability. Those people that we don't even consider, such as those who don't have a diagnosis of ADHD, or those who just prefer to read and take information in auditorily, we're not even thinking about that community. So we're just focused on that 60 million. And there's a healthcare literacy crisis right now, according to the CDC, Center for Disease Control and Prevention. And to fix that, I've designed this accessibility tool where it provides information to individuals in the forms of American Sign Language, voiceover, as well as plain language captioning. So plain language captioning is extremely important because it drops the language of that document down to a 5th or 6th grade level, making it so that anyone can read and understand, whether you have a neurodivergent disorder or you're a veteran who has a TBI and you're navigating the VA website. And so by creating this technology, we're transitioning to an API platform, which will allow it to integrate into any software So you can log into a website and have access to VoiceOver, have access to American Sign Language interpreter, and also see that information in plain language statements to help you better comprehend and make more informed health decisions.
No,
I hope that wasn't too techy.
It was a lot techy.
I'm sorry,
but you got the information.
Okay.
But I'm a veteran, so that piqued my interest there.
Yes.
And have you heard any feel-good stories, or how have people that have used the inclusive scan accessibility, people that have used the inclusive scanning, how has it helped them?
So before we do that, I have to tell you, I am a proud military spouse. My husband is an active duty service member, currently serving his last few months out of the country.
Which branch?
Army.
That's right. That's
he
the one.
is, yes, 20 years. We hit 20 years in a few months, so super excited
Tell
about
him
that.
I said who?
Absolutely.
Yeah.
I've heard that many times. So the stories that we've gotten back from the community have been overwhelming. Individuals have reached out to us and said, like, this would have helped me prevent certain illnesses that they currently have. We have one gentleman in particular who currently has kidney failure. Well, he was taking his diabetic medication incorrectly for years, taking it even when his blood sugar levels were stable, not realizing that he wasn't supposed to take it every day. All because he was given a pamphlet on this information and it wasn't in his first language. He's a deaf man.
Okay.
And American Sign Language is his first language. And a lot of people don't know this, but American Sign Language is its own language with its own syntax, its own grammar structure. It is not a derivative of English. It's its own language. So if I gave you, do you speak any other languages, Rodney?
I speak a little Spanish.
A little Spanish, perfect. So if I gave you a document in Spanish about your health, you might understand a few words, but not fluently enough to make an educated decision about your health.
That's
right?
true.
That is the same concept when you speak about someone who is deaf, whose primary language is ASL. They may know a little bit of English. Maybe they, went to a primary school, but not enough to make informed decisions about their health. So we've had an overwhelming response from the deaf community that we work with. And in regards to those with visual diversities, my daughter is a cancer survivor of retinoblastoma. She lost her right eye. When I've spoken to families who are RB, we call them RB families, who have children with RB, most of their family members have the trait. So they have some type of visual impairment themselves. And so when you're navigating health information, giving someone a pamphlet if they have any type of visual diversity, it's not going to sit well because they can't read it. And most people, unfortunately, Braille is outdated, so that doesn't fill the gap. They prefer to take that information in auditorily. And so when I've met with those individuals, they've told me, like, this is groundbreaking. It's revolutionary. It's innovative. And then when we talk about the neurodivergent community, we're not just looking at those who necessarily may be on the spectrum of autism or have Down syndrome, but persons like me who live with ADHD. For me, I can read a document, but I'm not going to retain it the first time. So I may have to read it 4 or 5 times. And I remember when I was navigating the health space with my daughter, reading about her diagnosis and types of treatments. I'm an educated woman. I have 2 degrees. I run I consider myself to be pretty educated, but I struggled to retain that information because of the heavy jargon. Right. And thankfully, my husband was there to support me, but every family isn't set up like that.
True.
People should be able to make decisions independently, and they should be met where they are, not giving this and it's considered a luxury or an option for you to be able to access it. So inclusive scan bridges that gap. It fixes that problem, not just for one community, but for many communities across the country.
And I can see it being beneficial because even if you call your provider's office, they may not be able to have the perspective to help, like you just laid out.
Yes.
Like someone that speaks a little Spanish, but they can get a document and not know the fine details of it. And patients aren't calling saying, I need more clarity.
Right.
So this kind of fills that gap.
Absolutely. And when you say that, it's important to remember too, and again, this is from the CDC, when you don't understand your health, you're more likely to visit the emergency room. You're more likely not to follow treatment instructions. Patients who don't understand these forms, think about when you go in for a surgery or a pre-op or a colonoscopy, especially a colonoscopy, because they give you this long form. You got to drink that nasty stuff.
Did it.
If you miss a step on that and you show up, they're going to cancel your appointment. And now you got to be rescheduled a month out. What if you are high risk for colon cancer? So now it's just, I can keep going. So I'm going to stop because I told you I can keep going, especially because I'm passionate about this. But people don't understand just how important it is unless you've had to deal with it.
All right. I'm going to get you out of here on a couple more questions because I know we got a 2 o'clock.
Okay.
Got a hard stop to get you to another appointment.
No problem.
But talk to us. You partnered up with Cone Health. And it seems like, it's a natural fit. So what are you guys cooking up together?
Cone Health has been absolutely extraordinary. They have been the first healthcare system here in North Carolina to understand how imperative this technology is. We are scaling inclusive scan throughout their healthcare system over the next few years. We'll be scaling them into different departments, starting with healthcare literacy, the importance of maintaining your high blood pressure, blood sugar, quitting smoking and things like that. And then we plan on expanding throughout other departments within their healthcare system. They've also worked with me to partner with other healthcare systems out of the state. But my goal is to partner with as many North Carolina-based healthcare systems, especially those in rural areas, to bring more awareness to the work that I'm doing. And so I'm hoping that that's another area. But Cone Health, all I can say is kudos to them for understanding the importance of the work that I'm doing.
My wife is a midwife at Cone Health, so
Really?
I'm sure she would. I'm gonna tell her about what you're doing.
Absolutely.
And this should help their program. I shouldn't bring it up because I can't speak to it confidently.
Yeah.
But they do have an initiative. I think it's called like 5 and 5. There's a couple of zip codes
To
that
reduce health.
the life expectancy is 5 years less in these marginalized community areas. So this also
directly aligns with that.
Right.
Yes.
So it makes sense.
Absolutely.
Makes sense.
Absolutely.
Good call on that one.
Yes.
How can I'm a listener listening on one of the podcasts, or I'm a viewer watching on YouTube, and I say I want to be a part, I want to take part of programming. What can they do? Or if I'm in a school, he's a principal at a school and says, I need this for my school or whatever. How can someone that's listening, take part in this and learn more?
Yeah. Regardless if you're in the healthcare sector, education, religious, or just a community entity, you can email us at info@MyASLTeacherRocks.com. You can also find me on LinkedIn under Summer Stanley. That's Somer. I also want to back up just for a moment and acknowledge Jacqueline Boone. Jacqueline Boone at the Greensboro Cultural Center, Creative Greensboro, has been a huge supporter in partnership with our organization.
Okay, how so?
Oh, man, we've hosted several events with her in partnership for bringing awareness to the community. We're hosting Deaf Arts Connect on September 5th.
Next time, tell Jacqueline to hook up with us so we can come over there and maybe cover it or something.
I would love that.
Yeah.
October, we're hosting our Black Interpreter Conference, which is going to bring in over 300 interpreters to that space. So I'll keep you posted.
Okay,
yeah.
Absolutely.
But yeah, they can find us on social media under MyASL Teacher Rocks or Inclusive Scan, whichever one they want to follow. And they can always reach out directly to me.
All right, thank you for that. And I missed out on one question. What's next? What you expanding? What's going on?
So I have desires to partner with the Greensboro Science Center to make it more inclusive for deaf and hard of hearing children. So I want to work with Glenn. We've sent him some messages, so we hope to speak with him soon. I also want to work with the City of Greensboro to improve communication methods for getting information to marginalized communities, similar to what we're doing in healthcare, but working with emergency warning systems and just information in general about transit information and anything additional to make sure these community members are kept abreast of what's happening. And I would love to partner with other hospitals across the state to make Inclusive Scan and, a household name when it comes to healthcare literacy here in North Carolina, starting here, but definitely expanding outward.
Well, I think you're going to get it done, too.
Thank you. I'm excited.
Well, I'm excited that you're here, and I'm glad to hear about this program. We're going to be hearing much more. And don't be a stranger. Call us and come back.
Sure.
And definitely in October, we can look at something.
Well, thank you.
We got to thank our interpreter here, Yolanda.
Yes, Yolanda Allgood. Yes,
Yeah.
We have to thank her. Yolanda Allgood is actually our interpreting services director. She is the one that schedules and plans all of our conferences and workshops, but she also serves as my personal interpreter when I'm out in the community, sitting on panels, etc. So she came all the way from D.C. to make sure she was here for me today. So thank you, Yolanda. I know you can't say anything, but thank you.
Bring me back a go-go CD next time. I'm trying to make her laugh. All right. Hey, thank you for joining
Thank you,
us. I appreciate
Rodney.
you, Summer.
I
And
appreciate
Yolanda,
it.
thank you as well. well. And also our listeners and viewers out there, you can download this episode and watch it as many times as you want on demand. And stay tuned in weekly by subscribing to Talk City Greensboro on iTunes, Pandora, and don't forget you can download Talk City from SoundCloud. That's it for this week. Thank you for tuning in. Be sure to watch GTN, your official source for news and information about the city of Greensboro. GTN is available on Spectrum Channel 13, AT&T U-verse Channel 99, and Lumos 31. GTN also streams live on Roku and the city's website at greensboro-nc.gov.